Okay, everybody. Thank you for attending tonight's webinar. This is the webinar for October 2024. I'm Dr. Richard Kim, and I'm here to talk to you a little bit about regenerative medicine and what we can do with regenerative medicine. Some quick instructions for you, just some housekeeping to get out of the way. If you can't hear me, turn your volume all the way up. Also, there is a Q&A button either on your web page or somewhere on your screen on your phone, and it should be labeled Q&A. You can ask questions through here. I am going to save answering all of these questions until the very end. Likely there's going to be a lot of information covered, and so you may get your question answered in the meantime. But let's get started. So the basics of how stem cells solve pain. This is a first Q&A to start. This is both from Julie C. from area code 346 and James C. from area code 518, and some really basic sort of questions, see how it works, and also the process and expected results. So what we want to go over is talk about what exactly regenerative medicine is, and we also want to talk about who regenerative medicine can help. Gerard from 315 says simply how this procedure will relieve back pain. That's a great question, Gerard. But some real key pieces of information, and you're going to hear me say this throughout, is that this is a non-surgical process and that there's no medications, chronic medications involved. A lot of these results can last many years, and for myself, I've been practicing stem cell and regenerative medicine for 10 years, so I have a good understanding of how well these work, who these help, and so on. We really all have common goals, don't we? Both you as a patient and myself as a physician. Well, we all want the same things. We all want to avoid surgery. We all want to stop medications because either for one reason or another, we're tired of taking them repetitively, having to remember taking them, and of course, there's all sorts of side effects with that. And we also want to improve our quality of life. That's a pretty big motivator for a lot of us. But in order to get there, we want a plan. We want a physician. We want a practice that's going to help us with a plan to get there. And in that plan, we want it to be low risk. We want there to be a short recovery. And we want to avoid any unnecessary pitfalls. Here's two great examples. Number one, there is a retired psychologist who flew airplanes for a hobby, was a runner, competitive, and also for stress relief. But the back pain ended his running. That meant no more competition, no more fun. The stress relief was gone, and that really limited his flying time. There was also a chef, a younger patient, a chef who really enjoyed spending time with his family, but the constant motion, the moving of the heavy restaurant equipment really led to a lot of back pain. This was affecting his work, making the difficult workday. Was at the point of contemplating changing careers and felt as though he couldn't continue on. For us, and I say us as in all of us in the world of everyday medicine, really feel like the things that are available to us miss the target. The traditional treatment limits are number one, surgery, which is permanent, it's invasive, often involves a long recovery, some facts that we don't like. Secondarily, we've got medications. And medications really fall into one of two major categories. One, steroids, which we know are a band-aid and don't last very long. But the problem with steroids is that they both weaken and they damage tissue. That means that repeat steroids lead to repeat weakening and repeat damage of tissue. And of course, something that doesn't help us. And effect that doesn't help us. Over-the-counter medications can certainly help and lessen symptoms, but the effects wear off, requiring you, the patient, to have to do a repeat dose. That's either several times a day, or maybe sometimes it's every day, or even on a regular basis of every week. About 2 months after stem cell therapy, the psychologist returned to running, ran the 4th of July race here in our local hometown. It was a 4 mile race, ran a 13-minute pace, which is a little bit faster than I could definitely run. But he had the confidence to train for a half marathon with his grandson. And so that was a really good example of how not only he got back to his quality of life, but helped him even think about achieving some goals and setting some goals for himself and his family. The chef was back at work full time, providing for his family, able to maintain his same job, same sort of lifestyle, same sort of income, which was important for them. This is how we think about pain and degeneration. We want to break this cycle, the cycle of pain leading to degeneration, then leading to more pain, then leading to more degeneration. And this is probably best evidenced by year after year, where symptoms get slowly but steadily worse. We are really the third solution. For us, we feel we have a fairly high success rate, and something that gives you years of relief. With us and our type of cellular therapy, we have something that has guaranteed acceptance. Your cells are your own, and therefore rejection is impossible. The graph here is how our patients typically respond. Once they do show signs of improvement, it is constant and it is week after week and progressive. So week after week, patients are noting that they can do more, they can feel less, they can be more functional week after week. But what exactly is regenerative medicine? So, regenerative medicine really is a field of medicine, and the goal here is to restore and not replace tissues. We're talking about damaged tissue into healthy and functional tissue. The different materials here are used to restore the different materials used here to restore this level of health is both platelet-rich plasma or PRP and secondarily stem cells. Now, when do we decide which to use? When is PRP good for me? When is stem cells good for me? So PRP is great for people who have that green or yellow circle size problem, small, medium. And then stem cells we usually reserve for more medium and medium large problems, which is evident in the red circle there. Here's a good example of how cells attack the areas of damage. If red is bad here, then the green is good, and the green is the cells attacking the area and therefore eliminating it. But you feel the red as pain and stiffness, sciatica, nerve pain, shooting, aching, grabbing type sensations. One of my favorite examples of how this works is that is the Pac-Man problem and solution. If we look at the game of Pac-Man, the pellets are the inflammation. Pac-Man eating one pellet at a time is about what PRP does. But when many Pac-Man eat many of the pellets all at the same time, that's kind of what stem cells are doing. But the goal here is not to just simply get to the next level and then face a whole new set of problems. The goal here is to really beat the game and leave the problem behind. How well? Well, depending on what we're treating, anywhere from 5 to 10 years. So where exactly do these cells come from? So for the purposes of this slide, the cells come from the back of the pelvis, which is the spinning set of bones there. And we extract them, we harvest them, we process them, and inject them back into, for example, degenerating discs or into and around nerves, into joints and knees and hips and shoulders. Here's a basic timeline and schedule of the protocol in our office. We of course like to start off with the consultation. We like to understand what your problems are, and we like to understand how exactly we're going to be able to help you. And of course, if we're not able to help you, we'd like to know that as soon as possible. Once the consultation is done, we like to schedule the MRI. And this is when the injection protocol starts. We start off with the first platelet-rich plasma, And then we enter into the second injection, which is some weeks later. And we call this the stem cell and second PRP injection. And then several weeks later, once more, a third injection. So there are multiple areas being injected with multiple different substances. And of course, this is what we like to call the functional approach. And of course, during a consultation, I can help explain that further. But once we get that through that third injection, we're starting physical therapy, we're starting chiropractic care, and we're starting core therapy, chiropractic care and exercises. Where are the issues or where are the problems that we can help with? Well, we can help with stenosis, we can help with arthritis, degenerative disc disease, and sciatica. And that's, of course, anywhere along the spine. We can alleviate a lot of lower body pains, arthritis of the hip, the knee, bursitis, meniscus damage, Achilles tendon damage. Upper body also is applicable, rotator cuff, arthritis, tennis elbow, carpal tunnel, issues in the wrist, etc. And of course, we get a lot of questions as to whether or not patients are a candidate. And for us, one of the more important things is this area that you are suffering from injectable? If an injection can get to that spot, we can also or operate on that spot. We can deliver stem cells to that spot. For us, it's important to know first to be able to get a diagnosis from you, and having an accurate diagnosis is critical. Having an accurate diagnosis really means that our location is going to be accurate, in which case our therapy is therefore going to be accurate. And all our therapies always include an MRI, so that entire 3 injection process that I showed you involves an MRI. What if you've had surgery in the past? And the answer is yes. So during our initial consultation, we'll talk about that. What surgeries have you had? What kind of surgery you've had? When was it? We certainly want to understand and know all of the details surrounding that. And of course, again, what is the diagnosis that you're dealing with now? How is the imaging that you've had recently? And if you haven't had imaging, certainly need to know that. The history and exam is, of course, important to every doctor-patient interaction. The type of surgery is critical too, whether it's an arthroscopy, whether it was a fusion of a spine, a rotator cuff surgery. Here's some frequently asked questions. Where will my stem cells come from? And I showed you in that early slide that we do obtain bone marrow from the posterior of the pelvis, but we also obtain it from fat. And these stem cells that we inject into you always come from you. So never from what we call peri-birth products or from a jar, a vial, a laboratory. These will always be from you. Second question of how long before I can become active. And so usually once we hit that last injection, PRP number 3, from that point forward, you're allowed to become more active, return to some of your activities. Of course, we like to see physical therapy help you get stronger, and you're going to be able to do more as you get through that. Next question of when do I feel the benefits? Benefits typically are felt between injections 2 and 3. You'll notice the beginnings there, and then that steady and gradual climb. How long will the tissue stay repaired? So for a lot of joints, we're looking at, for knees and hips, we're looking at 5 to 7 years, and then spines and cervical spines or necks, we're looking at closer to 6 to 10 years. That's just the way some of this has changed. The results have worked out, but that's been pretty consistent for our 10 years of having practiced. And then the question of how well this works, and there's a lot of elements that go into this. Your level of health coming into this, and of course, what is the level of and extent of damage. All of these sorts of things have been helpful. So let's get to some frequently asked or some Q&A section here. Eric T from area code 315 said, treatment of bulge disc impinged nerve root from degenerative disc disease. This is my jelly donut analogy. If you could think about a disc as a jelly donut, the jelly and the donut is the center, and that's the part when you're bulging, or even more specifically with herniation, is the part that leaves the donut. And of course, when the jelly leaves the donut, that's what's creating that irritation to that nerve. That then creates this inflammatory stenosis, and you can see where the blue is within that big circle. That's the disc. And if you can imagine jelly leaving that donut, it can irritate that yellow nerve that's just passing by that disc. Stem cells in discs mean helping keep jelly within the donut. And that means less pain and less nerve irritation, which is, of course, what we want. Versus something like surgery where they're just sort of cutting or scraping some of that away, but it really doesn't alter the quality or the functionability of that donut. Martha S. from area code 315 said stem cells for arthritis, stem cells for degenerative conditions, discs, etc., efficacy and options. So definitely stem cells are something we utilize for people with spine arthritis, degeneration of discs specifically, words like in diagnoses like spondylosis and stenosis. This is really a non-operative solution. Everything happens in our office, and everything is done as an outpatient. So you walk in, no general anesthesia, have the procedure done, and you walk out of here and recover from home. So for a lot of the spine type procedures, as I was mentioning before, we have results going 6 to 10 years. And that's from, that's not just what's published in the literature, but that's our experience here in our office. And we've been able to obviously replicate that for the last many years here. Michelle M. from 585 said, what treatments are available for severe low back pain? So our therapies help anywhere from mild to severe levels of low back pain. Our methods are non-surgical. What's important for you, Michelle, and I would say, is that really you have the back pain, but do you have a diagnosis? If you don't have a diagnosis, that's okay. During our consultation, I'll help decide what your diagnosis is. If you have any sort of imaging, that's always helpful. Not necessary to have before, but if you do, certainly bring that along during your consultation. So that leads me to say, in preparation for the consultation, having your story as to, when things started, what have you done, what have you tried, surgeries, injections, all of these things are helpful. But imaging is similarly helpful. But if you have it, great. And if you don't have it, no worries. We always have plans to incorporate the MRI since we have one in our own office. Roger B. from area code 518 says, stem cell therapy effective for lumbar spine that consists of 3 fused vertebrae with instrumentation. Stem cell therapy effective for sacroiliac joint dysfunction that is caused by 3-level lumbar fusion. So this is a really great topic, and I'm sorry, Roger, that you're suffering from this. What we're talking about in your case, Roger, is something called adjacent segmental disease. And what happens during a fusion is that you've made a permanent loss of flexion by welding those 2 bones together. So that means the disc above and the disc below now are forced to compensate for the flexibility. This unfortunately speeds up the degeneration of that disc above and then now that disc below. And when you fuse particularly the very lowest segment, guess who suffers next is, of course, the sacroiliac joint, and that's where the dysfunction there comes from. We've treated many people post-surgery, very successful at reducing pain, improving quality of life. We do not do anything with the fusion or the discs that are in that level, or especially if they've been replaced. But that's not to say that, just because you've had surgery, you're never going to have pain again. We know that to absolutely not be true. Repeat surgeries after things like fusion are very common. And then this is obviously one way to help you avoid that. Gary L. from area code 607 said, why would we come to you when chiropractic, acupuncture, PT, and three pain management groups plus radio frequency ablation have had no effect? This is a fantastic question. It really is in the philosophy. When you talk about chiro, acu, PT, pain management, we're talking about a completely different strategy. Our approach and our solution is really that it's a solution. So you went to these pain management groups to really help manage the pain versus our idea is to solve the pain. Solve the pain in what I'll call semi-permanent fashion, where we can help achieve many, many years of pain relief, and then, of course, repeat and then get you many more years again. A lot of things like chiropractic care and acupuncture is about symptom control, um, and really just trying to make you feel better, so to speak. But for us, it's really changing the biology of how the joint works, or changing the biology of how the disc works. If you can change the biology, you can change not just how you feel, but how that disc functions or how that joint functions. And that's really where we differ from some of these other modalities that you've tried. Not to say that these modalities are not important. They absolutely serve a role. And for a lot of people, these are very effective solutions. It's just that our strategy is very, very different. Terry from 514 says, explanations of the procedure and timeline for approval of these injections. So the timeline I showed you before, these are typically 3 injections. Our usual is a 6-week timeline on those injections. And everybody's, of course, a little bit different, but that's, I would say, fairly standard for us. FDA is a little different conversation. The FDA conversation with us is that there are FDA guidelines for how stem cells, platelet-rich plasma, are handled. There isn't so much an approval process as this is a procedure. If I were to take those stem cells and try to inject somebody else, then FDA then calls that a drug. But if we're simply taking stem cells out and injecting back into you with what we call minimal manipulation, these are not considered FDA approval requiring procedures. But there are guidelines. And of course, we adhere to all of these guidelines, for which we respect deeply and want to see the science pushed forward. Stephanie from area code 315 said, will this help with low back weakness? Denise P from 603 said, options for knee replacement. So Stephanie, weakness is often a nerve-related issue. The primary purpose for which we do our therapies is pain. Oftentimes nerve damage, as part of my typing there, nerve damage can benefit, especially when the pain and the weakness are linked. Some important information for us when it comes to nerve damage and whether or not nerves will recover is number one, whether or not there's how long the time of damage has been, and number two, if there's a wax and wane component, meaning that sometimes the pain is there, sometimes the pain, or sometimes a nerve issue is there, sometimes a nerve issue is not there, versus when you have that steady level of nerve involvement, then we tend to think that that nerve may be permanently damaged, and then in which case no injection, no surgery, nothing will help recover that. And that's something that we like to talk about and really sort of get the details on during our consultation. For Denise, this is absolutely an option for knee replacement. It's not just for spines and for necks, but it is this non-surgical idea. And unlike steroids and unlike gel shots, one of these therapies lasts several years. The beauty of it is, of which there are many, one of them is that it is repeatable. So you can go X number of years and then repeat that. The other piece that is certainly very favorable and very attractive about this is that it's natural. The cells came from you and the cells are going back into you. And there isn't any other foreign substances, foreign materials, cells that come from other places or other people. So that part is attractive. Stephen B. from 540 said, explain stem cell regenerative procedure as an alternative to knee replacement. So when it comes to knee replacement, we are talking about osteoarthritis in a lot of cases, especially when it comes to knees and hips. Ankles certainly suffer from arthritis. This really changes how arthritis affects your knee and eliminates the pain. You still have arthritis afterwards, but you just don't have the pain associated with it. The important points for us is always that this is 5 to 7 years of pain relief, and when it comes to knees, but of course repeatable. This is all within our office. There's no hospitals involved, no general anesthesia involved, and certainly the results for us have been excellent. So some basic ideas of how this works and how well it works. Donna F. from 315 said possibilities for arthritis. Marianne H. said from area code 518, I'd like to explore more information regarding treatment for knee osteoarthritis. Viewing your webinars might be helpful to me. Thank you. Thank you for watching, Marianne. So arthritis really is a degenerative condition. And as we talked about before, the pain and degenerative cycle, you know that year after year, it gets worse. You know that this year is worse than last year. And if you don't do anything about it, next year is going to be worse still. But this solution is minimally invasive. We're talking about shorter downtimes. We're talking about quicker recoveries. We're talking about no long scars, hideous scars on your body. We're talking about zero hospitalization. Everything is done in the office and you recover from home. So a lot of attractive features. Here's another Q&A, area code 518. Types of stem cells, potential applicability to neurodegenerative diseases such as Parkinson's. So we get this question a lot. Can you help MS? Can you help Parkinson's? Can you help Alzheimer's? That I will give you some basic science background on this. Number one, what we use are something called mesenchymal stem cells, and mesenchymal stem cells are the type of stem cells that live in bone marrow, but also the type that live in fat. We are 100% autologous, meaning that they come from you and back into you. When they come from somebody else and then injected into a different person, we call that allograft. We do not do that. And actually, there is no legal allograft product for our indications here in this country. There may be some experimental or some trials that are ongoing, but there is no off-the-shelf product. Yes, different rules for different countries, but that's a longer conversation. For our purposes, it's strictly musculoskeletal. We're talking about neck pain, back pain, knee pain. So when it comes to MSK or musculoskeletal and Parkinson's, if there is a component of musculoskeletal that is exacerbating your Parkinson's, and we just saw a patient this week where treating their MSK pain helped them deal with their Parkinson's type symptoms, especially when it came to balance and these sorts of things. That's where I think some of this can be really valuable, but solely for the purpose of Parkinson's, there is no current protocol. Nancy from 518 said estimate of how much this costs, along with what it is and what it does. So this really is a pain solution. It's not just a pain management idea, but a solution without surgery, without medications. And we get this question a lot about costs, and it isn't a one size fit all. Not everybody gets the same thing. It really depends on you, depends on what we discover during our consultation, and it depends on how we're going to change or modify our protocol to meet your needs. And so everybody's needs vary, and therefore costs vary. But certainly during a consultation, that's something we are happy to go over and discuss with you at the end. Steve N. from 514 said, I've been diagnosed originally with spinal stenosis, which then changed to arthritis of the spine. I'm sorry to hear that, Steve. I've been dealing with pain for over a year. I've had cortisone injections, have not helped. I'd love to learn how I can get back to living without pain. So stenosis really means narrowing of the canal. And I sort of blew up gave a magnification of the picture there. And so you can see the close relationship between the disc and all that is in the yellow and red, which is the spinal cord. And so you can see how very small changes in the disc are going to very quickly impact those nerves or even the spinal cord, then leading to stenosis. And stenosis just means that it's the narrowing of the canal where you're supposed to have nerves run through. Um, in general, there are very limited options, treatment options for the stenosis, and for a lot of good reasons. It is a very difficult thing to treat. And the addition of the arthritis, in your case, Steve, certainly compounds that pain. Um, for us, we're treating the disc, and we want to obviously solve the disc health through a more biologic solution. This is why we like regenerative medicine as much as we do, is that it's something that gives a high degree of benefit with very, very low risk. It's pretty ideal in that regard. And anybody who's spent any time in medicine knows that that sometimes is one of the tougher things to know about different therapies that you're receiving, because it's not always plain. It's not always well understood. And we talked about having a plan by physicians earlier. We want to avoid pitfalls, but we also want a high degree of success. Steve P. from 917 said different therapies offered. So we are a 100% regenerative medicine practice, and there is a vast range of therapies, not just stem cells and platelets, but a lot of it depends on what we're treating. So it depends if it's a spine or a joint or a tendon or a nerve, and these things can vary. So for you, Steve, be interesting to hear from you what you're looking to treat, and then we can go through our range of options for you at that point. Terry D from 514 said solutions to my back and hip pain. So back and hip problems happen together all the time. There's a very, very close relationship between the two areas. And so this is something we see quite often. Stem cell therapy applies to both problems. So both problems of the spine and problems of the hip. When it comes to deciding who to treat first or what to treat first, we typically focus on spine first, and that will help you develop a stronger core. And when you can develop a stronger core, then treating the hip or knee or ankle or shoulder then becomes an easier task. And of course, any conversation with a physical therapist, you'll realize that that's typically where we focus our initial therapies. Gail R. from area code 315 said, lower back pain, not sciatica, that keeps me from standing to do anything such as walking much, doing household work, making beds, sweeping floors, mopping, etc. I have to go sit down and the pain subsides and have no back pain. Quite a while ago, diagnosis of osteoarthritis and or osteopenia has been terrible last year and seems to be getting worse. I also get right hip pain, left knee pain, feel a need for an update on what's going on. 71 years old and was an avid golfer, gardening, mowing lawns, etc. until about a year ago when the issues have gotten worse. Like to see Dr. Kim's webinars. So if you're watching this, Gail, you have a sense now, hopefully, of what we do and how we do it. But this really sort of highlights the point that a lot of these problems are degenerative, which means year after year after year, they get worse. And for different people, they get worse at different speeds, we'll say. Some people get worse very quickly. And some people feel some more sort of incremental worsening year after year. In listening to your story there, Gail, I'm suspicious for spinal stenosis. So I'd certainly like to meet you and get some more facts about your symptoms, and then help to make that diagnosis. And remember, for us, disc is holding that tunnel open. Therefore, a degenerating disc means that the tunnel is actually shrinking. For us, we have an in-house MRI, which helps us make that diagnosis or confirm that diagnosis quickly, and then obviously also get you to therapy, to injections and our therapies quickly. Kathy P. from area code 315 said stem cell therapy for bone-on-bone knees, as well as stenosis of the lower back. Again, we can help bone we can help both. It is a slightly different protocol and a slightly different approach for both, but even the knees that have been diagnosed bone on bone, clearly, that's a diagnosis of arthritis, very common for us. Again, the three-step process with an MRI included. Stenosis is, again, in that conversation about the jelly leaving the donut, or the donut then compressing, which is then affecting the tunnel. Again, very common diagnosis, a three-step process once more, and the MRI is included in our entire protocol. Joseph C. from area code 315 said, I've lived with lower back pain for over 40 years. Now it may be the source of new pain from my neck to my upper legs. So two very important things for you here, Joseph, is number one, the length of pain that you've had is not a factor. It does not disqualify you. So we've had patients with decades worth of pain, and we've helped them to get out of the pain and return to normal life, return to normal exercise, and an improved quality. Age is also not a factor. So guessing if you've had pain for 40 years, just by early estimates, we'll say even 60 years old or more. We've had patients as young as 17 and as old as 94 with success. So we've treated both ends of the spectrum when it comes to that. Patricia C. from area code 518 says, how can you help me with severe cervical and lumbar disease? And the basic answer is yes. We help both areas. How we perform these are a little bit different, just technically speaking. And I will tell you, quite frankly, that I'm one of the few physicians who is able to treat cervical disc disease. That's a very technically challenging one, but we've had great both experience with it and great results with it. So certainly something we can help with. And that's when in either location, cervical or lumbar, you're hearing about things like degenerative disc, arthritis, stenosis, and some more terms that fit into that category of degenerative state. Our stem cell experience goes for over 10 years, and we've been doing stem cell of the spine for over 6 years. So we have quite an extensive catalog of both patients, ages, disease types, etc. Mitra H. from area code 514 said, I have an L5 herniated disc, need to live active without pain. I'm 53-year-old female. So herniation is once more that jelly leaving the donut. And for somebody who's 53, I can imagine you're trying to avoid surgery. You're trying to avoid invasive procedures. Herniation and degenerative disc disease are cousins. Once you herniate, it leads you to develop degenerative disc. And once you have degenerative disc, it puts you at increased risk of herniation. So having one solution for both is the ideal. Once you herniate, the likelihood that you are going to herniate in the future is then high, of course. Terry D. from 514 said, approximate cost overall in Canadian dollars. It really depends on what we're treating. For you, Terry, I don't know what the diagnosis is. I don't have a copy of your imaging. I want to see what your updated MRI is like. So it really requires us to meet and go over some of these details before understanding a cost. Consultation is therefore necessary so that I can understand what exactly you will need. Diane B says, from 518, so many questions. I hope through this process you got some answers. But of course, if you've got more questions, even still, consultation is going to be your very next step. And whether it's imaging or simply conversation and understanding the procedure, we can help you through that during our consultation. If there's information that you need, richardkimmedicine.com, our webpage, has a fair wealth of information, both about what we do, how we do it, some testimonials of patients who've done this in the past. And you can find a lot of our prior webinars where I say the first half basically the same, but the questions and answers are accumulations of 1 month of people writing in and wanting to learn more. Teresa H said, I'd like to see if from 315 said, I'd like to see if you can help me with constant lower back pain, mid back pain, ethic pain, and sciatica. I'm thinking maybe you meant neuropathic pain. So this is a good topic. Sciatic nerve is basically a wire running underground or underneath your skin. And depending on where that wire has changed signal, if they're with interference, is sciatica. So whether you're high in the wire or you're low in the wire, we call that all sciatica. So for instance, if you have a wire running underground, it could be a tree root, it could be a rodent. In our case, it could be a muscle, it could be a ligament, it could be a tendon, it could be a scar. It could come from the spine, from degenerative disc disease and arthritis and stenosis. So understanding where that is coming from for you, Teresa, is going to be what helps us really solve the problem. But if you obviously are having the low back pain along with the sciatica symptoms, I think it's safe to say that the point at which your wire is being signal is being interrupted is high up. Bonnie A said from area code 315, stem cell therapy for rheumatic arthritis, rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and lupus. So very much so. So autoimmune diseases such as these destroy joints, and they can also lead to arthritis. We've used stem cells for many people's autoimmune joint destruction. It doesn't change the fact that you have rheumatoid arthritis, but it helps preserve the joint that you do have left and you have remaining. And then obviously that then helps you either delay or avoid, and we hope avoid a knee replacement altogether. And that goes for we've treated people with rheumatoid arthritis, psoriatic arthritis, Crohn's and ulcerative colitis, ankylosing spondylitis, lupus, polymyalgia rheumatica, many people who have these joint destroying diagnoses. Eves from 604 said knees have no cartilage. So pain in the knee without cartilage is often coming from the bone itself. And I will tell you a small tip here about how our office and how our practice is certainly different. And this is something that basically we are doing, but not many do. We not only are injecting into the joint, which we call intra-articular, but we're injecting into the bone, which is called intraosseous. And like I said before, because when you don't have cartilage, a lot of the pain is coming from the bone. So that means we're going after not just within the joint, but we're going within the bone itself. And this is one of the key differences about us and our practice. And after 10 years having followed the research, followed the data, how we're really at the forefront and doing things very much unlike a lot of the people or a lot of the smaller practices. All right, so that's the end of my questions. I'll answer some Q&As if I pull that up here in a minute. But I'd like to offer this for you guys, webinar attendees for free consultation. The caveat is that you have to call Friday by noon, and you do have to mention webinars, and you do have to schedule a consult. The phone number for us here is 518-871-9900. And for our northerners, the phone number up there is 514-697-8919. RichardKimMedicine.com is our webpage. /webinars is where you can see both this webinar uploaded in a couple of days, but you can see all our prior webinars as well. And you can see a lot of our social media type short clip videos to help with your understanding of stem cells and regenerative medicine and platelet-rich plasma. /MRI is where you can submit your information and our office will call you and schedule you for a direct MRI. No requisition, no referral, no script is needed. You just simply have to call. We have an upcoming webinar again in November, and we'll update that on the web page here shortly. All right, so I am going to get out of this and go to the Q&A. So if anybody has questions and answers or questions that they want answered, please type into the Q&A section. We already have two, so I'll start here. So the first person who is an anonymous said, "Do you offer an open MRI?" And the answer is yes, we do offer an open MRI, and that's true of shoulders, knees, hips, spines, what have you. And so that's a fairly easy one. But you don't have to have, again, you don't have to have a script to schedule this MRI. You just need to call and we take care of the rest. And for those Northerners, this goes for you as well. There's no requisition required. Just call direct and you can get it. Next is from Eric. I had an MRI in September. What on my part would I need to do should you want access to it prior to a consult? Great question. So Eric, if you have a copy of the disc, that is going to be the most helpful. If you have a copy of the read, also helpful. If you can obtain these things beforehand, it certainly helps. At the bare minimum, we ask for the read, and then we can work on getting the images after. But if you have all of that handy, or if you can bring a computer and show us the portal, and get us either a screenshot or however, those are all great ways that we can access some of that data and go into the consultation with definitely a little more information. Okay. So anybody else with questions? I'll hang out for a few more minutes. All right, it seems like we're good with the questions. And again, hope to see you in the office and come armed with your questions and everything you want answered. Happy to go over everything with you guys and get you guys to a better quality of life and a life with less pain. Otherwise, have a great rest of your Wednesday, and we'll talk soon.